This is Jerry Hesch with the Hesch Institute in Henderson, Nevada, near Las Vegas, Nevada. And this is part 2 of our presentation titled Lateral Foot Pain in Marathoner who quit running 2.5 years with failed diagnosis, failed treatment. This is part 2, post-treatment at Hesch Institute. So we finished treating him and it was just about 10 minutes long. And so I will come and we'll take a look at him walking. I don't know how he actually responded to it, so we're going to discover that together. So go ahead and start walking up and down that same trajectory. And come on back. And let's get you to go one more time, please. And feel free to comment if you're aware of anything.
I had told you when I got here that I felt like I was walking on the lateral edge of my foot, and I don't feel that any longer.
Okay, let's have you lie on the table, please. So I'm going to just start with the shoulder girdle, since we're up at this end of the table. So I'm able to load that shoulder girdle. I'm able to get some spring mobility, some recoil. If I do that correctly, there's a final recoil. It's not exactly the same as left side. A little bit more work to do. You're a little rigid here going inferiorly. I can make it spring inferiorly, but the other side's certainly freer. So there's a little more work to be done there, but I think we're off to a good start. So now we're going to look at the hip. Let's see if we made any gains there. So earlier we had, I'm sure this is a different camera angle, but we had you at about 15 degrees of internal rotation. It was very hard end feel, and I'm at 20 now, and there is a softer end feel. Any comments?
Absolutely. No, it feels less restricted.
Okay. Was hoping to gain more dorsiflexion. I think I did test that one thing after I worked on you, and I have you at 10 degrees. We'll check back later and see if there's anything we can do to gain a little bit more. But this is 5 degrees of gain there. The cuboid I did not actually work on directly in my haste, perhaps, but the mobility is there. That feels normative. Okay. You did not have superior glide mobility of the fibula, but I can now see movement traverse through that structure on up to the pelvic region. The mobility of the forefoot is improved, but I'm especially interested in the subtalar joint. Your symptoms were greater on the right side, and this has more play. I'll try and film that with you laying on your stomach. It should be more obvious then. And here is varus mobility. And you know, by design, you don't have a lot of mobility. I created some gain in this pattern, and that's your norm, in my opinion. But I feel like I can take you into a little bit of eversion. And the left fibula does spring superiorly. Subtalar mobility, I think the camera can capture that rather readily, and that just didn't move like that at all. So there's a little bit of eversion play, a little bit of inversion. So the mobility there is improved. Let's have you lie on your stomach with your feet hanging over the edge. I'm going to check that camera angle again. So I think that's pretty good there. I work out of a home office because I do writing and teaching around the country and research, and so I also spend one-on-one time with my clients. Typically spend 2 hours with them because the folks that come see me have been around the block a few times, like yourself. You're at the 2.5 year point, and it allows me to practice this way that I just feel like I'm being true to myself. It's not an incredible business model, but it is what I choose to do. Now, with you lying prone with the feet hanging freely off the edge, I'm going to stabilize the left tibia and you can see there's free mobility in that subtalar joint. I could constrain the tibia and fibula by squeezing the malleoli together. That would take subtalar out of the system, and you still have subtalar mobility. Not a lot. Okay, so at the factory, you didn't sign up for being a marathoner. Okay, but now you have, you know, more inversion than you do eversion. But by design, for reasons that we don't know, this part of your body is different than the rest of your body. For some reason, you've got quite rigid feet, and I'm going to have a limited ability to, you know, restore considerable mobility here. So these are not the best shock absorbers, but we have improved the ability of these of your feet and ankles to absorb shock when you walk, because we've improved some normative mobility. I'm curious to know what you feel, and I'm certainly not through. There's more work to be done. This fibular head, if I can strain down here, I get a little bit of spring mobility there, and on your right one it feels posterior in comparison. And when I try and spring that does not move. You did mention occasional symptoms up near that fibular head, and that's one more movement that I want to restore. So I'm going to just move the camera for a little while, do a little bit of work there, and we can look at my skeleton here, look at his feet, and I'll be back in about 30 seconds. When you walked, were you aware of any difference?
It felt as if my ankles were freer, and that's been something that's through this whole 2.5 years. The ankles themselves felt very tight, and so I was aware of that, and I was aware of it just as you were manipulating my feet, that there was the sensation is that there's more movement there.
Okay. So I think what we'll do is stop filming here. I was able to gain more mobility through that fibular head. And so I think what we're going to do is set you free for today. I don't want to teach you anything today. I want to see how your body responds to the interventions that I've done. When you come back tomorrow, we'll do more hands-on work. Certainly that shoulder girdle needs some more work. I will try my best to make additional gains through the feet and ankle. My conclusion today, and I hope I'm wrong here, is that you have rather rigid feet and ankles. But we'll teach you how to keep the mobility that is your norm. Okay. But I'm curious to see what 24 hours does to that, and typically you will, clients tend to come back with even greater gains, because now the foot and ankle, subtalar joint, right cuboid, fibular head are all moving in a normative manner. Maybe not completely normative, but moving in a more normative manner than they have for some time. So they tend to actually gain some additional mobility, and it tends to be self-reinforcing. So we will do another film sometime tomorrow or at the third visit, and let you tell us how you're doing. And very interesting presentation. I thank you for letting us film.
Thank you.